Hello, I am Dr. Goel. I am a consultant surgeon in GI surgery. My main area of interest is obesity surgery and gastrointestinal oncosurgery. Today we are going to talk about side effects of obesity, the problems which obese people face in their lives. As we all know, there is a variety of problems which obese people face in their life. Sexual problem is one of the very important problems which alters their lifestyle, which alters their psychology, which alters their way of leading life. Today we are going to talk about sexual problems in obese people. Sexual problem in obese people is a huge spectrum. If we talk about men, there is a loss of libido, there is a erectile dysfunction, there is an inability to penetrate. These are some of the common problems faced by obese men. By various studies, it has been proved that around 70% of people who are obese and who have diabetes will have some sort of sexual problems as we have described above. Their body image contributes to the sexual displeasure or the inability to have proper sex. Their body structure also limits the ability to have sex. There is also hormonal imbalance in these people which leads to erectile dysfunction, leads to decrease in libido. This in turn leads to a lot of psychological changes in their life, which in turn again leads to decreased sexual pleasure. Another common condition in obese men is because of the excessive fat in the lower abdomen and in the groin area, there is a visual impression of a smaller penis, which is also known as buried penis syndrome. This also leads to decreased penetration while having sex. All these compounded together again leads to psychological stress and in turn leads to decrease in libido and decreased sexual pleasure. Similarly, in women who are obese, there is decreased libido, there is a hormonal imbalance, there is a psychological stress about their body image, which in turn leads to decreased sexual pleasure. Also, because of the heavy structure in the lower abdomen and in the groin area, there is a decrease in the penetration. The ability to have the act of intercourse is very difficult. This all in terms combined leads to greater psychological stress. There are a lot of studies available now which suggest that once you lose weight, your sexual pleasure increases, your libido increases, your body image improves. Similarly, in obese women, there is enough evidence to suggest that once they lose weight, there is an increase in libido, the act of intercourse is more pleasurable, there is a deeper penetration, the hormonal imbalance gets corrected, which in turns lead to better psychological state of mind of a patient. So the perception of a sexual pleasure is much better. Bariatric surgery is a very important tool to lose weight. It is for people who are not able to lose weight on their own by non-surgical methods. Bariatric surgery is done by keyhole method where we reduce the size of the stomach by stapling it. Thus, the ability to eat reduces drastically and patient starts losing weight. There are a lot of hormonal changes which happen with the diabetes which are positive, which also leads to the treatment of diabetes. Diabetes, as all of us know, causes a lot of damage to the arteries and to the nerve in terms of neuropathy, which reduces the ability to perform and also leads to erectile dysfunction in men. Once all these pathologies are corrected by bariatric surgery, body image improves, patient gets more agile, patient becomes more active, the hormonal balance tilts in favor of better sex, the testosterone level becomes improved, hence leading to a better sexual life. There are a lot of studies available today which suggest that losing weight after bariatric surgery leads to a very happy sexual life in all age groups of patients, and there is a lot of improvement in erectile dysfunction, increase in libido and ability to perform better sex. Thank you very much.